Did you know that clinicians agree that aerobic exercise is key for stroke recovery, but that many face barriers to implementation? My name is Kevin Mosion, and today I'm going to present my research to try to improve aerobic exercise implementation in stroke rehabilitation settings. Stroke is a leading cause of neurological disability worldwide. When an individual has a stroke, they experience direct neurological deficits which result in activity limitations, cardiovascular impairments, physical inactivity, and sedentary behaviors. Now this is coined the cycle of inactivity. What can clinicians do to try and prevent this cycle of inactivity? Luckily, clinicians agree that aerobic exercise is key for stroke recovery. Research has shown that aerobic exercise improves cardiovascular fitness, walking abilities, activities of daily living, and physical activity participation. However, does it translate into everyday practice? Research conducted by Nathu and colleagues in 2018 found that 75% of stroke rehabilitation programs exclude individuals with severe physical impairments, and 28% of programs exclude individuals with coexisting cardiac conditions. Unfortunately, this means that access to aerobic exercise remains limited and inconsistent in stroke rehabilitation settings. So the question remains, how can we bridge this gap? How can we improve the implementation of aerobic exercise in clinical practice? The purpose of our scoping review was to identify and describe any barriers and facilitators to aerobic exercise implementation as reported by healthcare professionals in adults post-stroke. What did we find, and what are the implications for clinical practice? Well, first, we found that limited access to resources, including lack of equipment, space, time, and support, influenced the implementation of evidence-based practice. Specifically, we found that a lack of access to screening tools and exercise stress testing results can result in clinicians using subjective measures to prescribe and monitor aerobic exercise. Now, this is an important discrepancy between clinical practice and best practice guidelines. We also found that lack of knowledge, skills, and beliefs, including concerns over an individual's cardiac status, can lead to uncertainty in prescribing safe exercise. Given a complex medical history and a high prevalence of cardiovascular comorbidities in most people with stroke, it is important for clinicians to possess the requisite knowledge and skills to safely prescribe aerobic exercise at appropriate levels of exercise intensity. Importantly, clinicians have reported an interest in gaining knowledge and improving skills that are necessary to implement this practice. Now, this is provided that they have access to training programs and resources such as support staff and treatment time to support this practice. In conclusion, our study identifies a variety of barriers and facilitators to aerobic exercise implementation in stroke rehabilitation settings. Our findings will help bridge the knowledge-practice gap and will allow clinicians and researchers to design future theory-informed interventions. I would like to thank the Heart and Stroke Foundation, Canadian Partnership for Stroke Recovery for funding this project, and to the Journal of Neurologic Physical Therapy for publishing this work.